Hello, my name is Jillian Lengler. I'm good. I'm going to be the one starting off my group's presentation on our critical public health issue. And for this public health issue, we've decided to focus on depression and how it affects those with disabilities. So in our group, we have Joseph, myself, Jose Luis, Trinity, and Sean. And these are each of our specific concentrations. So in terms of what we're going to be going over during this presentation, we're going to start with an overview of public health itself, and then we're going to be going into our specific critical issue. Then we'll be talking about our critical issue in the context of the 5 different public health concentrations and strategies that can be implemented with the different data collected from these 5 concentrations in order to make an improvement in this critical issue. And finally, we'll be closing it out. So the overall objectives of this presentation is to have a better understanding of how many people with disabilities experience depression and the risk factors for it, the impact that it has on individuals with disabilities, and the solutions. So we're going to start, like I said, with an overview of public health. Public health is defined by the CDC as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, as well as individuals. And then we are going to be going into our critical issue, which is depression in people with disabilities. We have found that many people with disabilities do struggle with mental health illness, specifically with depression. And now the questions we must ask ourselves are, how can this be addressed and how can this be prevented? So with this, I'm going to hand it to Joseph so he can talk about depression in people with disabilities from a biostatistical point of view.
Hi, everyone. My name is Joseph Schrader, and I will be talking to you about the first public health concentration. I was our leader for biostatistics, and today I'll be discussing some of the biostatistics behind people with disabilities and mental health, especially depression. Let's first talk about some careers in biostatistics. First, there's a biostatistician. They analyze data and trends in various areas of public health. They can also work on one public health issue or large-scale public health concerns. Besides biostatisticians, there's also public health analysts. They help address critical health programs like screenings, and they gather and analyze data, sometimes working with the public as well. Now, how is biostatistics related to our critical issue with people with disabilities and depression? Well, biostatistics looks a lot at the statistics and a lot of the numbers behind a lot of these cases. And for people with disabilities and mental health, there's actually not a lot of places where you can find information or data. There are some websites that you can look at, though. At the federal level, you have the U.S. Department of Health and Human Services. They provide Healthy People 2030. The Centers of Disease and Control and Prevention provide the Disability Health and Data System. You can also look at state data there, too. For statewide information, there's floridahealth.gov. They provide the 2021 Florida Disability Data Report and the Behavioral Risk Factor Surveillance System, also known as the BRFSS. And for countywide and Alachua County, there actually is not a lot of information on mental health services or depression with people with disabilities, or even information with people with disabilities in general. They do also have some information on the BRFS and some information on the Florida Health Charts. But generally, you see a lot more information at the federal and national level, and not a lot of information on especially mental health for people with disabilities at the state level. However, there are some interesting statistics we can look at. Here's some statewide information we can look at. People with disabilities in Florida are actually 4 times more likely to have had depression. And if you look on the chart right here, this is the spread of people who have the percentage of people with disabilities who have had depression in 2020. And on the left here, you have mobility disabilities, and on the right here, cognitive disabilities. As you can see right here, cognitive disabilities, people with cognitive disabilities have much more incidences of depression. To look at some nationwide information, in 2020, 40.8% of adults with disabilities aged 18 to 44 stated they actually experienced depression. And in 2018, 20% of adults with disabilities in the United States experienced serious psychological distress. And for some interesting countywide information, through 2017 and 2019, 9.7% of all individuals with disabilities living in Alachua County had a difficulty making decisions due to physical, mental, or emotional conditions. Now, as you can see here, the only information we had on depression was statewide information. It was very hard to find statistics on depression at the nationwide level and at the countywide level, especially in Alachua County. However, we can use a lot of this information to possibly infer as to what may be causing depression in people with disabilities and how we can possibly help. Thank you for looking at my section, and I hope you enjoy the rest of the presentation.
So now I'm going to talk about people with disabilities and depression in terms of the epidemiology public health concentration. So epidemiology is the incidence and the presence and the possible control of diseases that are found within our population. So the different ways of measuring these things, like I mentioned before, we have incidence, we have prevalence, and we have mortality rate. So incidence is looking at how much of a certain population has the disease or illness that you are looking at. So in terms of the American population, depression is increasing. Specifically, it has increased 1.3% in the past 4 years. Prevalence is the amount of people within a specific population that have a certain disease. So 22% of people with a disability have been diagnosed with depression. Finally, mortality rate is the amount of people that have died because of a specific disease. So people with disabilities and depression are more likely to report as being suicidal or having suicidal thoughts. The risk factors of depression. So we have stress, gender, abuse, and education. Stress can lead to increased depression because stress causes the increased release of cortisol, which puts the CNS or the central nervous system in our bodies at risk of developing depression. Females have been found to be twice as likely to be diagnosed with depression as males. In terms of abuse, sexual, emotional, and physical abuse can lead to depression, specifically if these things occur earlier on in life. However, if they occur at any point during your life, you are at a higher risk for depression. Finally, we have education and the social pressures of doing well in school, and whether or not you actually do perform well in school can also play a role in depression. So finally, we have two different professions in the epidemiology field of public health. We have a field epidemiologist who works in the real life scenarios and they intervene at the local level. And we have an infectious disease epidemiologist who monitors possible outbreaks of infectious diseases that could be harmful to different communities.
So I will be speaking to you all about the social and behavioral sciences and its applications in our focus population. This concentration employs a socio-ecological approach to research while focusing on frameworks that explain the health differences experienced across communities. One concept that can help explain these differences are health disparities, which are the preventable differences in the burden of disease to achieve optimal health. Generally speaking, health disparities are experienced by socially disadvantaged populations, which can include racial and ethnic minorities, as well as people with disabilities. These differences can lead to influences in access and discrimination. Now, people with disabilities who suffer from emotional and behavioral conditions have the largest gap in coverage, as they tend to fall through the cracks of public health insurance. Consequently, these patients face an increased obstacles in accessing primary care providers, usually due to lack of insurance. The pressures and frustrations associated with access barriers can negatively impact health both physically and mentally. Discrimination encompasses the lack of consideration offered to an individual or group due to preconceived, unjustified opinions. People with disabilities face discrimination on multiple levels. Discrimination disproportionately affects ethnic and racial minorities, with African American youth suffering the highest level of depression due to racial discrimination. Further hesitation by providers reflects a lack of confidence for patients with disabilities and works to damage clinical outcomes for patients because of the gaps it creates through avoidance of necessary care. In order to combat these obstacles, we need to focus on promoting ideas of health equity, which is the principle that everyone has a fair and just opportunity to reach their optimal level of health. Holding providers accountable through laws that punish discrimination, as well as expansion of legislation such as the Affordable Care Act, can help with making healthcare more accessible and more affordable for individuals with disabilities. Overall, health equity is the gold standards our systems should be working at achieving. Now, two careers in this concentration that I wanted to focus on are social behavioral health consultants, as well as public health social workers. The consultant works in association with the integrated primary care team to ensure quality clinical consultation, while the social worker helps with families and the psychosocial support needed to cope with the chronic illness. Each career has a focus on the aforementioned topics and ensures that the patient, as well as their family, is receiving the proper social support needed to guide them through their healthcare journey.
So I will be going over health policy and management. Some of the health policies that we looked at were the Affordable Care Act, the Americans with Disabilities Act, and Medicaid. These all help people with disabilities by preventing discrimination in the workplace and public services. Also, they are able to identify the factors of accessibility to insurance and healthcare. More specifically, the Americans with Disabilities Act directly creates equality for those with disabilities and allows for there to be equal opportunities in employment, public settings, and transportation. Also, the Affordable Care Act has expanded to cover mental health within insurance. Some barriers that we saw were the longevity of care due to reductions in state budgets and rises in the federal budget. This is important because healthcare is heavily varied state by state and causes there to be movements to and away from certain areas due to healthcare costs being lower and higher in different areas. Also, there is stigma around care and scarcity of mental health services due to the access of healthcare not having a uniform definition across healthcare systems. Some career paths in health policy and management are health administration and case manager. Some responsibilities and duties of health administration is to develop work schedules for staff and physicians, manage finances, manage patient fees and billing, and ensure that the facility complies with regulations and laws. Some responsibilities and duties of a case manager are patient identification and assessment, care planning and goal setting, plan implementation and monitoring, transition, and discharge. Next, we're going to go over some healthcare costs. The average cost of healthcare for a person with a disability per year in the state of Florida is $15,811. On average, a household containing an adult with a disability requires 28% more income to achieve the same standard of living as a similar household without a member living with a disability. Lastly, some costs associated with depression are private therapy sessions, which could cost about $100 per hour out of pocket, and antidepressants anywhere from $10 to $130 per month.
Hi, I'm Sean, and today I'll be discussing some of the environmental health contributors to depression in those with disabilities. And so before we even focus on those with disabilities, we have to point out that the source of depression for most Americans, about a third of that's going to come from hereditary conditions, while about two-thirds of that is going to come from environmental conditions. So basically, nurture is actually going to have a bigger effect on people than nature in this situation. And then specifically for those with disabilities, some of the main contributors to this will be their physical differences, their visual aesthetics, and then their intellectual differences. And so stressful experiences in childhood can influence formation of mood disorders like depression in those without any disabilities, but specifically in those with disabilities. And this could be explained by interactions between someone's genes and their environment. And so those with disabilities often struggle with activities of daily living, which makes them feel more dependent on others, which again traces back to those physical contributors. And potential aesthetical differences can very easily spiral into self-esteem issues that makes them feel like they're not as capable as those who are able-bodied. And so ableism is, again, another big thing that's going to be a stressor and a environmental problem in those with disabilities. And so this stems from generally any kind of culture, but specifically Western culture, where norms and attitudes perpetuate the idea that certain types of ability are more valuable than others. And this can lead to microaggressions that could be a joke, an assumption, or just any kind of inference that those who are able-bodied are superior in any form to those who are not. And this leads to devaluation in culture and specifically leading to worse self-esteem for those people who are going to have less confidence, drive, and belief in their skills in a work environment, a school environment, anywhere where people are going to be able to judge them. And so below, we just provided a couple careers in environmental health that might help those with disabilities feel more intuitive and incorporated into their environments. And that's a state or federal environmentalist and an environmental health technician. And both of these basically survey the environment surrounding these people. It could be anyone, but specifically in this case, those with disabilities, in trying to find the best way to coexist. And so lastly, we just created a model that kind of puts this all together into one piece and shows how environmental factors, as well as other factors, specifically in this case genetics, can pose risk factors for those with mental health, and that both of these will directly contribute to our health population, which is those with disabilities, and poses a higher risk factor for those with disabilities as opposed to those who are able-bodied.
The first strategy we are going to be talking about is insurance. Insurance protection for individuals with disabilities who are employed can be seen at the societal level of the CDC's social ecological model. Being able to improve insurance plans with mental health coverage can be done by Medicare coverage in Florida for children and redefining Florida's priority to keep families together and improve overall mental health care. Also, improving Medicare access for individuals with disabilities under 65, including mental health care access. They could face greater issues when enrolling for Medicare access compared to Medicare beneficiaries over 65, and 18% of Medicare beneficiaries under 65 were unable to receive mental health care or medication that they felt that they needed. Our second strategy is assessments. Improving the quality and access to mental health assessments for people with disabilities. This can be done by developing screen tools for specific disabilities, which can be seen at the individual level of the CDC's social ecological model. In Alachua County, the mental health first aid can be tailored to assess the needs of people with disabilities.
And I'm back. Alrighty, now that we've talked about some of the strategies we can use to help people with disabilities manage their depression, we can now summarize the presentation and talk about some final points. In our presentation today, we were able to highlight the important information about our special population, people with disabilities who have depression. We firstly were able to define the public health, which helped us understand the scope of the issue and how we can use public health methods and concentrations to address depression in people with disabilities. And then here are some of the major points from each of our concentrations. As you can see here, we have important points from biostatistics, epidemiology, social and behavioral health, health policy and management, and environmental health. With these concentrations in mind, we were able to gather a more defined view of how we can help people with disabilities find better solutions to managing depression symptoms and also finding better treatment. This led into our strategies, where we looked at strategies to improve insurance quality and access, and as well as improving assessment. Thank you very much. And here are some of our sources. Page 1, page 2, page 3, page 4. And that is it. Thank you very much for watching our presentation, and I hope you enjoyed.